just in case, sorry. Okay, it's a pleasure to present our project. Here's a disclosure. There are increasing concerns related to surgical residents, surgical trainees' preparedness for independent practice. Recently, as much as a quarter of surgical residents reported a lack of their readiness for independent practice, prompting many to the additional training. In fact, vast majority of the surgical residents extended their training through the sub-specialized fellowships, including fellowship council programs. However, there's a lack of evidence demonstrating that whether or not the fellowship training adequately prepared the surgeons for independent practice and how it meets their training needs. The purpose of this project was to determine the fellows' perceived preparedness for independent practice after graduating MIS and bariatric fellowships, and to determine whether fellowships meet their needs, and to identify any educational gaps. This study design was a mixed method approach, starting with quantitative research methodologies, including semi-structured interviews and focus groups, in order to explore some of the motivators and the reasons for pursuing fellowship training. We conducted 14 semi-structured interviews with graduate fellows and 2 focus groups with graduates and program directors. In order to explore the real reason of doing fellowships. These qualitative investigations were used as a framework for developing the questionnaire in order to identify and quantify the unmet training needs and their readiness for independent practice. A novel survey was then circulated to graduate through the fellowship council from the past 3 years. The following 5 themes were merged to better understanding the role of fellowship in preparing surgeons for independent practice: professional development, job marketability, autonomy, networking and collaboration, and practice management. Professional development is gaining advanced skills and refining expertise in the management of surgical patients, transition into the role of the leader, such as an independent surgeon and a mentor and a researcher. Job marketability is enhancing marketability in order to find the ideal job, and whether fellowships are needed or necessary for employment as a staff surgeon. Autonomy is a gradual increase in the degree of autonomy, ownership of the patient care, and evolving relationship with mentors and attending surgeons, opportunities to customize the fellowship toward the career goals. Networking and collaboration is creating a forum for communication with the other experts and colleagues in the area of their interest. Practice management is the development of the skill to manage the independent practice, for example, billing, coding, scheduling, and work balance between the clinic and academic activities. Based on the framework developed during the qualitative phase of this study, a web-based questionnaire was created, addressing each theme emerged in order to comprehensively explore their fellowship's individual experience. The agreement scale was used to evaluate their fellowship experience with each theme. Checkbox questionnaire was used to evaluate their expectations for fellowship and self-perceived competence after the fellowship, with 60 minimally invasive surgery and bariatric procedures. Here's the result. A total of 201 graduates completed this study, and the response rate was 41%, mean age was 35, and 80% were male, and 20% completed more than one fellowship. Moving on to each of the theme, first, professional development. The vast majority of graduates were highly satisfied with their operative and non-operative case exposures. For bariatric procedures, the gray bars indicated the proportion of the respondents who desired to learn the listed procedures during the fellowship. The red bar indicated the proportion of the graduates who did not feel comfortable performing these procedures after the fellowship. The percentages represent the graduates who did not feel comfortable these procedures divided by respondents who desired to learn. The most obvious gap exists in the area of biliopancreatic diversion with duodenal switch and revisional bariatric surgery and therapeutic endoscopic bariatric procedures. For MIS procedures, as you can see, many graduates feel comfortable performing most listed procedures. The gap exists in the lap esophageotomy and the lap hemorrhaectomy and the lap total gastrectomy, and the lap CBD exploration and the lap adrenalectomy. In particular, when asked about the management of surgical complications, the gap exists in stent for anastomosis leaks and balloon dilation of stenosis. In terms of job marketability, 83% represent acquired job that were aligned with their skills and expectation, while 70% sought additional clinical or academic training after the fellowship in order to be a better, more competitive candidate for a desirable job. The majority of the respondents have received assistance in the job search process from the program directors or other mentors. 24% reported receiving minimal support to find a job. Theme autonomy. 82% had the opportunity to customize the fellowship trainings to suit their personal training needs, such as case mix. 28% managed more than half of the cases independently from their attending surgeons during their training. About 30% rarely or never performed the case independently during their training period. Reason for this listed by the respondent included medical legal reasons and institutional policy and a lack of permission from the attending surgeon. Despite this, there is no significant relationship between the reported proportion of the case performed independently and the comfortable level of performing the procedure in practice after the fellowship. Despite feeling competent to manage the listed or certain clinical situations, 60% reported that supervisors did not decrease their level of supervision in the OR, and 80% in the preoperative outpatient care, 31% in managing complications. Networking. 90% were provided with opportunities for networking with other experts and colleagues in that area of their interest. Under the theme, practice management, about 40% of the respondents reported that understanding coding and billing procedure, hiring staff, and managing insurance issue didn't meet their expected needs. In conclusion, graduates of the Fellowship Council accredited fellowship, non-NCMG fellowships are highly satisfied with their individual training and acquired desired job aligned with their career goals. FC fellowships adequately prepare the surgeons for independent practice However, some training gaps still exist. Educational gap exists mostly in the area of practice management and a greater need for autonomy in the management of the complications. Thank you.